In many cases, fatty liver causes no noticeable symptoms, but you may feel tired or experience discomfort or pain in the upper right side of your abdomen. Hey, welcome back to my channel. Myself Dr. Zarrin, your health guide. So recently, I did an Instagram poll that should I do a detailed video on fatty liver? And to my surprise, I got a 95% of majority who told yes. I'm so grateful to have a curious Insta family who's always ready to acquire knowledge because learning never stops. So in my OPD, I encountered a 17-year-old patient. On asked about medical history, I got to know that she was suffering from fatty liver. So what is fatty liver? Today we'll be telling you everything you need to know about fatty liver. It happens when fat builds up in the liver. Having a small amount of fat in your liver is normal, but too much can become a health problem. Your liver is the second largest organ in your body. It helps process nutrients from food and drinks and filters harmful substances from your blood. Too much fat in your liver can cause liver inflammation, which can damage your liver and create scarring. In severe cases, the scarring can lead to liver failure. When fatty liver develops in someone who drinks a lot of alcohol, it's known as alcoholic fatty liver disease. In someone who doesn't drink a lot of alcohol, it's known as non-alcoholic fatty liver disease. Fatty liver develops when your body produces too much fat or doesn't metabolize fat efficiently enough. The excess fat is stored in liver cells where it accumulates and causes fatty liver disease. This buildup of fat can be caused by a variety of things. For example, drinking too much alcohol can cause alcoholic fatty liver disease. This is the first stage of alcohol-related liver disease. In people who don't drink a lot of alcohol, the cause of fatty liver disease is less clear, but some or the other causative agent is always present. One or more of the following factors may play a role: obesity, high blood sugar, insulin resistance, high levels of fat, especially triglycerides in your blood. Certain genes may also raise your risk of developing fatty liver. In many cases, fatty liver causes no noticeable symptoms, but you may feel tired or experience discomfort or pain in the upper right side of your abdomen. Some people with fatty liver disease develop complications including liver scarring. Liver scarring is also known as liver fibrosis. If you develop severe liver fibrosis, it's known as cirrhosis. Cirrhosis may cause symptoms such as loss of appetite, weight loss, weakness, fatigue, nose bleeding, itchy skin, yellow skin and eyes, web-like clusters of blood vessels under your skin, abdominal pain, abdominal swelling, confusion. Cirrhosis is a potentially life-threatening condition. To diagnose fatty liver, your doctor will take your medical history, conduct a physical examination and order one or more tests. By medical history, if your doctor suspects that you might have fatty liver, they will likely ask you questions about your family medical history, including any history of liver disease. They'll also ask about your alcohol consumption and other lifestyle habits. Any medical conditions that you might have, any medications that you might be taking, recent changes in your health. If you have been experiencing fatigue, loss of appetite, or other unexplained symptoms, let your doctor know about it. Then comes a physical examination. To check for liver inflammation, your doctor may palpate or press on your abdomen. If your liver is enlarged, they might be able to feel it. However, it's possible for your liver to be inflamed without being enlarged. The doctor might not be able to tell you if your liver is inflamed by touch. There are many other tests which could be done, such as blood tests. In many cases, fatty liver disease is diagnosed after blood test, which shows elevated liver enzymes. For example, your doctor may order alanine aminotransferase test and aspartate aminotransferase to check your liver enzymes. The test might be recommended if you have developed signs and symptoms of liver disease, or they might be ordered as part of a routine blood examination. Elevated liver enzymes, signs of liver inflammation. Fatty liver disease is one potential cause of liver inflammation, might be many causes. Certain imaging techniques. Your doctor may use one or more of the following imaging techniques to check for excess fat or problems with your liver. Ultrasound exam, CT scan, MRI scan. They might also order a test known as vibration controlled transient elastography. This test uses slow frequency sound waves to measure liver stiffness. Liver biopsy is considered the best way to determine the severity of liver disease. Liver biopsy, a doctor will insert a needle in your liver and remove a piece of tissue for examination. They will give you a local anesthesia to lessen the pain. This test can help determine if you have fatty liver disease as well as liver scarring. Do you know the stages of fatty liver? Fatty liver can progress through 4 stages. Simple fatty liver, there is a buildup of excess fat in the liver. Steatohepatitis. In addition to excess fat, there is inflammation in the liver. Fibrosis. Inflammation in the liver has caused scarring. And lastly, the last stage, cirrhosis. Scarring of the liver has become widespread. Cirrhosis is potentially a life-threatening condition. In many cases, lifestyle changes can help reverse fatty liver disease. For example, your doctor might advise you to limit or avoid alcohol, take steps to lose weight, make changes in your diet. If you have developed complications, your doctor might recommend additional treatments. To treat cirrhosis, for example, they might prescribe lifestyle changes, medications, or either surgery. Cirrhosis can lead to liver failure. If you develop liver failure, you might need a liver transplant. Lifestyle changes are the first line of treatment for fatty liver disease. Depending on your current condition and lifestyle habit, eat a nutrient-rich diet that's low in excess calories, saturated fat, and trans fat. Get at least 30 minutes of exercise every day. If you have a fatty liver disease, your doctor might encourage you to adjust your diet to help treat the condition and lower your risk of complications. They might advise you to do the following. Eat a diet that's rich in plant-based foods including fruits, vegetables, legumes, and whole grains. Limit your consumptions of refined carbohydrates such as sweets, white rice, white bread, and other refined products. Limit your consumption of saturated fats, which are found in red meat and many other animal products. Avoid trans fat, which are present in many processed junk food. And the most important, avoid alcohol. So lastly, we need to know about the preventive measure. To prevent fatty liver and its potential complications, it's important to follow a healthy lifestyle, such as avoiding alcohol, maintain a healthy weight, take steps to control your blood sugar, triglyceride levels, and cholesterol levels. And lastly, follow your doctor's recommended treatment plan for diabetes if you have it. Aim for at least 30 minutes of exercise most days of the week. I hope it was a useful content. If you heard something new or learned something new, be sure to click the like button, subscribe to my YouTube channel, and also hit the bell icon so you get notified every time I upload something new.